All right, great. Thank you so much, Andrea. So next we'll move on to Andrea Patton. Her presentation is titled, Why Do Youth Use E-Cigarettes? Analysis of the National Youth Tobacco Survey 2016 to 2022. Andrea is a behavioral epidemiologist and the head of prevalence research at the Center for Substance Use Research at CSUR. Andrea's primary research interest lies in designing studies among underage populations to support regulatory submissions in the US and Europe. Andrea has previously led behavioral research programs at the University of Edinburgh and has also worked for the Scottish Government, healthcare regulatory agencies within the UK, and the Royal College of Physicians. And so with that, we will kick off Andrea's video.
Evidence from the Cochrane Systematic Review on E-cigarettes for smoking cessation suggests that e-cigarettes can help adults quit smoking for at least 6 months. However, the contribution that e-cigarettes can make to tobacco harm reduction is often overshadowed by the use of e-cigarettes by youth. Understanding why some youth use e-cigarettes can be used to inform public health policy and regulatory decisioning to prevent youth from using e-cigarettes, while continuing to allow adults who smoke access to e-cigarettes to assist in completely switching away from or significantly reducing their cigarette consumption. So why do youth use e-cigarettes? Anyone seeking to answer this question can look online and immediately see the Truth Initiative's website, which presents 3 main reasons why youth use e-cigarettes. A family member or friend used one, they are available in flavours, or they are perceived as less harmful than other tobacco products. Almost 1/3 of youth reported the availability of flavours as a reason why they had used e-cigarettes. And it's the availability of e-cigarettes in flavours such as fruit and menthol that is at the centre of current public health debate and regulatory decisioning as to whether the benefit flavoured e-cigarettes may provide to adults who smoke sufficiently outweighs the risk to youth. These data were taken from the National Youth Tobacco Survey, an annual cross-sectional survey of middle and high school students in the United States. However, these were reasons for youth use of e-cigarettes in 2016, but NYTS data are publicly available up to 2023. Using NYTS data between 2016 and 2023, this study aimed to determine the main reasons youth report for using e-cigarettes and if the reasons for youth use of e-cigarettes changed during this time. In 2016, NYTS subjects were asked, "What are the reasons you have used e-cigarettes?" And subjects could select one or more of 9 response options. As we've just seen, the most commonly reported reasons for use were a friend or family member used one, the availability of flavours, and e-cigarettes being perceived as less harmful than other tobacco products. We see a similar pattern in 2017 and 2018, whereby use by a friend or family member, the availability of flavours, and being perceived as less harmful were the most often reported reasons for youth use of e-cigarettes. In 2019, NYTS introduced new response options so youth could report using e-cigarettes because they were curious about them or because they could do tricks with them. Over half of participants reported curiosity to try as a reason they used e-cigarettes, and use by a friend or family member remained a significant reason for use. Around 1 in every 5 subjects reported using e-cigarettes to do tricks or because e-cigarettes were available in flavours. In 2020, curiosity remained the most reported reason for e-cigarette use. This year, use by a friend or family member was separated into 2 response options, and we observed that using an e-cigarette because a friend used one is reported much more often than using an e-cigarette because a family member used one. In 2021, NYTS introduced 2 more response options so youth could report using an e-cigarette because they were feeling stressed or anxious or to get a buzz from nicotine. As observed in previous years, using an e-cigarette because a friend used one and curiosity were the most often reported reasons for use. Almost a quarter of subjects reported using an e-cigarette because they were feeling stressed, anxious or depressed, and over 1/5 reported using an e-cigarette to get a buzz or a high from nicotine. In 2022, we observed a similar pattern of main reasons for use: friend use, curiosity, to get a buzz from nicotine, and feeling anxious or stressed. We observed the same pattern of main reasons for use in the most recent NYTS data from 2023: friend use, curiosity, feeling anxious, stressed or depressed, or to get a buzz or a high from nicotine. We can see that the reasons for youth use of e-cigarettes have changed between 2016 and 2023. Focusing on flavours, we observed that in 2016, 1 in every 3 subjects reported using e-cigarettes because they were available in flavours. When this is compared to 2023, around 1 in every 8 subjects reported using an e-cigarette because they were available in flavours. In summary, peer use has continually been reported as the main reason for e-cigarette use. When additional response options were available for selection, we observed that youth reported reasons for use of e-cigarettes related to experimentation, including curiosity, to get a buzz or a high from nicotine, or to do tricks. NYTS 2023 data suggests that flavours are now the 7th most reported reason as to why middle and high school students in the United States use e-cigarettes, compared to the 2nd most reported reason in 2016. However, it is unclear if reasons for e-cigarette use have changed over time, or if the change observed is because the question text and response options available within NYTS are different. Thank you for listening.
Research updates. Would you care to share those with the audience?
Is this on? Yes, I do. So within NYTS from 2021, the question changed slightly. So in 2016, the question was, why have you used e-cigarettes? Whereas in 2021, the question changed to, why did you first use an e-cigarette? And with that, a question was also included as to, why do you currently use e-cigarettes? So I didn't include the analysis about why do you currently use e-cigarettes within that video, mainly because of time. But I have the results to share today. So if I can just remember where this slide, yeah. So the most often reported reasons as to why youth currently use e-cigarettes was, again, because they were feeling anxious, stressed, or depressed, to get a high or a buzz from nicotine, because a friend used one, or to do tricks. And through 2021 to 2023, we observed the same pattern, in that these are the most often reported reasons. And what we see is that flavours has remained about this 6th most often reported reason as to why youth currently use e-cigarettes. And the reason that we've focused so much on flavours is, I suppose, other NYTS data that we hear. So we see that there's about 2.1 million current e-cigarette users among middle and high school students in the United States. And figures that come from NYTS report that 9 out of 10 or 90% of those kids are using a flavoured e-cigarette. So I think the kind of message that is coming from that is that if there was no longer flavours, there would be no longer any youth e-cigarette users. I don't think it's quite as simple as that. What we can see here is that the behaviour is complex, and that flavour, just because you're using a flavour doesn't mean to say that the flavour is the reason why you're using an e-cigarette. And I think there is a difference that we need to highlight that. So these results are going to be included in a publication. It's written and it's about to be submitted. But I thought that I would share some of the initial findings with you today. So you take any question.
Great, thank you so much. I think Patrick has a question. And
I wanted to ask you, do they differentiate in NYTS? Is it any vaping? Is it nicotine vaping? Is it marijuana vaping? What vaping is the NYTS about?
So I think there is a question where what substance that you use in an e-cigarette, and I think I've seen data published on LinkedIn by someone else, I think it's Mark Crawford, and he did an analysis, and I think he's shown that it's now cannabis is the most frequently vaped substance within an e-cigarette, which has overtaken nicotine through the years. And this question was just, why were you first using e-cigarettes? And we don't have any kind of further information about, what was in the e-cigarette when you first used it, or when you're currently using it.
You show the different possible motivations, but aren't they mixed? Like to what degree one type of motivation, like relief of stress or curiosity, can be linked with each other? This is where it's not very clear. And also, I would like to argue for a very prosaic and common reason for teenagers to use it. Like if you have a heavy homework you know that if you get drunk or high, you are probably not going to be able to do your homework. But nicotine, you can be vaping all the time while you do your homework. It's a very practical reason why some teenagers might prefer to vape or might go into vape because of the perception that it's not going to interfere with their activities. And also the correlation between the different causes.
Yeah, I mean, I think so. Some of the figures that I've looked at for the publication is that, you know, if you've got 2.1 million current e-cigarette users and 1.9 million of those are using flavour, if you remove flavours from the market, are you going to get rid of 1.9 million current e-cigarette users? Whereas what we've seen is that in the most recent MITS data that 15% of youth reported using an e-cigarette because of the flavour. So then there's an argument, would you get rid of 15% of those 2.1 million or the 1.9 million? So you could get rid of maybe about 300,000 current e-cigarette users. But as we've seen, the reasons for e-cigarette use are complex. So for example, if I was taking the survey and I said that I use an e-cigarette because I was feeling stressed, and I also use one because of the flavours, and I also use one because I'm curious about it. If you remove flavours, then I still have two of my reasons why I use an e-cigarette involved there. So we did look at a sub-analysis where we looked at how many of the students reported that they used an e-cigarette because of flavours, and that was the only reason that they reported. So that was 1%. So if you then look at these 2.1 million, 1% of that, if you regulated flavours out of the market, would you want to be getting rid of 21,000 current e-cigarette users? When we talk about regulation and effective ways to reduce use the e-cigarette use, this may not be the most productive.
I see you focus on was for for obvious reasons.
I'm not going to recommend using nicotine to get your homework done.
That's
Anyone? Okay, get someone here.
and you'll see that
I used to do it. It works.
it's
Pascal Michel, PMI Canada. Just to add a commentary on this last comment about flavor. So in Canada, one big region is Quebec. They had a flavor ban recently. They had a survey just coming out yesterday. Like 32% of youth that vape went back into cigarette smoking due to a flavor ban. So that's the latest survey for Canada, just to give you a bit of a context. We may not apply to different markets, but that's the reality that our country is.
Yeah, I mean, within this as well, so this MITS is a joint collaboration between CDC and FDA's CTP. So they have access to the exact same data set that I had access to, and CDC website does have a web page and it says why use vape. So I looked at that, please feel free to Google it, and the reasons that they reported for use using e-cigarettes. So they started with exposure to tobacco advertising. Next they mentioned flavours. Next they mention social influence, so friends, as curiosity is included within that. And then the last reason is nicotine. And I think within that, the argument that is presented is that if you begin to use an e-cigarette, then you become addicted to the nicotine, and that encourages you to keep going. So we have done a bit of analysis around that as well. And we have looked at it solely around moving in and out of e-cigarette use. So we found that if you reported that you first used an e-cigarette because you were feeling anxious, stressed, or depressed, that is often the reason that you give for continuing to use it. But what we found the biggest group is that if you started to use an e-cigarette because you were anxious, stressed, or depressed, that when you were asked, you didn't qualify for the current use question because you were no longer using an e-cigarette. So what we want to do is to look at moving in and out of other tobacco product use. You know, if you're no longer using an e-cigarette, are you using something else? But it's kind of very different to the argument that is presented on CDC's website. I think the order of the reasons that presented on that website as well is quite misleading, in that exposure to tobacco advertising is listed as the primary reason, whereas if you watch the video again and you see all the bubbles, the very, very smallest bubble is 3.7% of middle and high school students said that they currently use an e-cigarette because they see people on TV or online or in film use one. So I think we need to look at these data, we need to publish these data, and we need to look at all kind of sides of it rather than this kind of single-minded, if we got rid of flavours, then we get rid of the problem of e-cigarette use.
Thank you.
It's a very long answer to your question.
Thank you.
Yeah, I've got a question with regards to the relationship for the reasons to use e-cigarettes and the use of cigarettes. So does the data tell you anything about why they haven't engaged in cigarette smoking instead of using the e-cigarette?
So what we could look at is the proportion of people who are using an e-cigarette and they're also using a cigarette. Whether they've ever used one and whether they currently use one, but I don't think that there's any reasons. The survey doesn't ask, what are your reasons for smoking? They do ask about reasons for use of nicotine pouches, but it's more analysis that we're intending to build in to try and build up a picture of what's going on.
First, thank you for the presentation and walking us through kind of the history of NYTS. One of the things that I thought was really interesting is we're talking about reasons for first use among youth. In most recent NYTS data, though, related to flavors, we saw that the top brands most referenced for past 30-day use were those that are disposables, illicit products that don't have pending PMTAs in front of FDA for approval and review. So when we're thinking about flavors or we're thinking about those products that are on the market today, those are illicit products from China that really shouldn't even be there. And just want to get your thoughts on that problem that currently sits in front of FDA. They've taken some action, but what your thoughts are there, if there's anything more that you think FDA should be doing.
I mean, I think that, thank you for your question, it's a good question. There is a lot more that can be done to prevent access. Access is a big factor. If you can't get your hands on these products, then you can't use them, especially if they're within, it seems quite straightforward, especially illicit products. FDA could definitely take more action to prevent them coming into the US and to crack down on places that sell these products. I think, when you mentioned the PMTA process, those who have legitimate products and they're doing the science and they're submitting that to FDA to get their products authorised, what my recommendation would be is to conduct the studies in underage populations. What you want and what FDA specify within their PMTA guidance for industry is that you need product-specific estimates of use. So, for example, if you don't submit that data, FDA, you're making it really easy for FDA to use the NYTS data where they say 9 out of 10 kids current e-cigarette users are using a flavoured product. Or, so if you're submitting a PMTA for a menthol product, then you can say, from 2022, it was a quarter of current flavoured e-cigarette users were using a menthol product. And that's the standard then that you have to demonstrate benefit. So my recommendation would be to conduct studies among youth to get estimates of use of your product. What we obviously find is that an estimate of use of an individual product or a flavour within an individual product sits below the level of use of a brand that's often reported in NYTS. So particularly these brands that are named essentially within the NYTS study, which of these brands have you used in the past 30 days. We have estimates of use of that brand. That's if you don't submit your product specific data, that's what FDA will use as well. And then that's your level of risk that you have to overcome with your adult switching studies. I think that regulating flavours out of the market is potentially, a diplomatic way to put it. It may not achieve the impact that is being suggested.
I don't have a dog in this fight, but what was it? So the person who asked the question, you may know, you seem knowledgeable. How many millions or hundreds of millions product applications whatever, 100 million applications for 100 million products. So when we have 100 million youth surveys for each individual product in combination to demonstrate that my specific brand, variant X, Y, and Z is appealing only to 0.000001, it's just not a practical way to, I think, deal with that problem. But we can disagree.
So I run a study that does that. So we have a study where we look at specific, obviously not all of the brands and all of the products and all of the flavours. We do look at that because we want to understand the prevalence of use of individual products and the flavours that they're available in. And that they could be submitted to FDA. I agree that we couldn't have a national survey that asks about absolutely every single product. But I think if you're a company that is legitimately trying to submit your PMTA, then that's the level of detail that FDA are asking for. And without that level of detail, then FDA are going to revert to the evidence that they have in front of them, which is, however % of youth are using your brand, however % of youth are using a flavoured e-cigarette.
Thank you so much, and thanks for the great discussion that we were